Dr. Iman Bar, it's so exciting. Your new office here in Newport Beach, Fashion Island. What is it that drives you and motivates you? Because you have so many advanced technologies. And I think there's a part to you thinking, you know, if you just do one or two therapies, people like it, but to get a result, isn't that what it's about, getting people a good result?
Yes, the results are very important, and we're result driven in, you know, that we do so many tests to get our patients in a better place, and it's all measurable, and then they get excited. Once they see the benefit and they see the numbers, they get more excited. And we're all visual beings, and that's very important because it is the best thing that anybody can do. We can go to many doctors and they say, let me do this test or give you that medicine.
Right.
But sometimes we're not consistent and we don't follow through because, you know what, we don't feel or don't see the difference. So that's why we're doing this.
Well, let's go right to the top. I want to start with the brain room. Tell me about the brain room. What's going on there?
So I wanted to do a lifestyle medicine kind of hub or location. So instead of just having the people just go somewhere everywhere, like go here and do this or that, I decided I'm going to work on the body as a whole. We're functional, you know,
Sure.
docs, and we love that. So looking at the holistic person. So we're not only a finger, we're made of like tissues, brain, body, mind, soul, right?
Sure.
So I wanted to do something in the brain room that's different. So now we know there are all these like measurable ways of finding how your brain waves work. So alpha, beta, delta. So we want to sleep, we need some more delta waves, then we can measure it now.
Right.
We need to be, you know, awake and creative, alpha, beta, you know, we want to have these in optimization. So we found that there are now technologies, it's biohacking, and it has a lot of AI involved, that now we can do like little like EEG, like those little, you know, kind of EKG, like little teeny electrodes. We put them on the brain and we can measure your brain waves and find out how we optimize your brain waves. So if somebody's stressed, somebody can't sleep, somebody wants to be more focused, or somebody is a little bit ADD and wants to calm down. So somebody with anxiety. So all these things have now brain programs that we can have them in the brain tank, we call it, and they get hooked up and we analyze and then we create an AI program for them, or we don't, the computer does. And that program just leads them through relaxation or better sleep, or even we have athletes that they have better focus and they can hit a home run without injuries. So there's a lot of new things now we can do in that brain room. Amazing stuff.
Well, one of my favorite states is the theta state. It's often referred to as like a hypnotic state where an athlete gets so good they can just do repetitive actions and get a result. And so once you get into that deep trance theta state, you're totally alert, but you're able to act accordingly at the highest level. And yes, exactly.
Yeah.
So it's kind of like automatically doing it like consciousness, and you're just doing your best. So I'm curious about the stem cell room. Tell me about that.
So I've always been fascinated with stem cells, and I wanted to have a center in Orange County that actually provides that service. I've seen so many. Last week I had a house call. Somebody just went to Panama. Unfortunately, she paid a lot of money. They told her a quote. She went there. They gave her more. Told her like, you gotta pay more. Like, what is she like now? Traveled all the way.
Yeah, of course.
And she's in a lot of
pressured.
back pain. Unfortunately, when I saw her, she was not relieved at all. She's 5 days back, and she's been in severe pain. I saw her. She was in bed.
Yeah.
And you know, she feels like she spent a lot of money. And I was concerned, and you know, I wrote the book because I worry about the stem cells given out of our country. There's so many regulations.
Not good.
So a lot of times they tell them it's not legal because it's modified, and you know that.
Right.
So
They
that is the
expanded them,
concern.
altered
They
them.
expand them, alter them, and then they tell the people because it's not legal in the United States. Well, yes. Heck yes, we do not want to modify or expand the stem cells because that carries the risk of cancer and modifying your genetic code. So that is the concern. So I wanted to have a center, integrative center. There are several treatments that are actually FDA approved. They're under clinical studies. There are so many clinical studies out there. People can be part of the study and can actually benefit from stem cells, whether it's autologous or if it is from the cord or, you know, donated in a cord bank. And then we receive them from the bank. For the patient, they're tested, they are 100% safe. There's so many regulations in the United States under those cord banks, and it's a tissue bank as well. So now we know they're safe for our patients, and we test them and we get the patients to get those treatments injected, whatever it needs to be injected. but also we advocate for people because that's going to be safer in the future to use their own stem cells.
Yeah, I've been the recipient of several stem cell interventions, and it's painless, it's effective, it's amazing. But to your point, I've also seen going out of country some adverse situations because they're not regulated, they're not doing the top standard. And I'm really happy that we're doing this here in Newport Beach, because I tell people all the time, listen, it's not about whether you can advertise or not and call it regenerative medicine. It's about going to a practitioner that has the right to order something in your best interest. Maybe it's not, quote, on label, but stem cells have been shown to be therapeutic. There's many studies about it. I wrote a book early on for physicians on stem cells and traveled around the world, and I came back to the conclusion we're best to do it here in the US under the proper guidelines with GMP quality, with the right intervention. And I've seen miracles, absolute miracles with people. So I think that this is exciting as well. And I have another question. You have another room that looks like it's pulse electromagnetic frequency. It has light therapy. Tell me about that room.
I know you love that stuff.
I love this stuff.
You're a bodybuilder, you're into sports,
Right.
I need to come and train with you one day. So it's all about the biohacking and then saving time. Most of the people that come and see me are executive, professional, people who don't have much time and spend hours in the gym. So I wanted to bring in biohacking, which is medical biohacking, meaning like there is measurable ways of finding out if you want to build muscle. We can do these, for example, HIIT exercise, high intensity exercises like on a Kegel bike, for example. But also when we do this, if we combine this with hypoxia, this is great. It's like high altitude training. So instead of building a little muscle, you get a bigger muscle, and it's measurable, which is amazing because we have a lot of now ways of measuring that, right? Biometrics, we call them, and athletes are using this in like competitive athletes and Olympians. The other thing, for example, they can also do, instead of gravity and lifting and benching and hurting themselves. A lot of the patients that come and see me middle age or older, and they're not supposed to be doing all this heavy lifting since they have not been trained at a young age and know what they're doing. Even with a trainer, unfortunately, I get a lot of people with a rotator cuff injury, or their shoulders is messed up, or their back is hurting. So, and then we go back to treat. So I wanted something that is actually AI generated. It is tone, and it's like tension versus gravity has a toll on your joints. And also it's measurable. And also I love it because we sometimes use the cuff, you know, the cuff training. So now we're increasing pressure, and that increases your benefits. So you might get 4x, 5x results on your muscles. So it's measurable. And then after that, for recovery, you mentioned that. So we put them on PEMF, we put them light therapy, cold, but it's not a plunge because I don't want to have wet stuff here. It's all very nice and kind of like spa-ish, like for guys, a bro spa. So we have the bed. So the bed is the cold immersion. However, because everybody doesn't have much time, we would do the bed with therapy that is light therapy for recovery and increasing your circulation. And then it's less time instead of staying in the plunge. But also we would add for that, you know, vibroacoustic or vibration. We are, you know, energetic beings. So we use vibration sounds and therapeutic treatments that now they get 3 treatments in one. And from there also we have a chamber that is the hot chamber. So it's not really like a sauna. And that also has hydrogen therapy, can also have light therapy. So you're doing multiple modalities. And that's what I like about this. You do less and achieve more.
Yeah, I like where you mentioned the band restriction therapy, because there's a lot of science that shows when you're exercising, you can cut your exercise time not only in half, maybe to 1/10, because you can do in 10 minutes, I'm famous for a 12-minute workout, where normally an athlete or individual would spend an hour or 2 in the gym. So there's good science to it. It works, it's effective, and I love it that you do so many other modalities, because it's not about just the intensity of the exercise, it's the recovery phase. And if you can teach people and guide them with the quick recovery, stop by your office here in Newport Beach, get that hooked up, get the plan that's going to help you recover best. But now I want to talk about my favorite. Love and connection, without exception. I've interviewed over 2,000 people over the last 20 years. To a person, I've always asked, what's the most important thing in your life? Is it your health? Is it your finance? Is it your love life? Without exception, everybody says love and connection. So you have what I call the love intimacy chair. What is this about? It helps with urinary incontinence. It helps with I'll just say, more intense pleasure. What is that about? And is it a pulse electromagnetic frequency? It's a magnet and it kind of constricts the PC muscles. Is that kind of where we're going with that? I've sat on it. I love the chair. I've seen women, I've had guys use it. It probably helps with ED, helps with maybe arousal disorder. Tell me a little bit about that.
Okay, so as we age,
Right.
we lose muscle, right? So
Right.
not only we focus on our biceps and the core, right? We need to focus on the floor,
Yep.
meaning your pelvic muscles. And
Right.
that's so important. So I tell, because we treat a lot of men, I tell men it's very important. One of the things you need to do to keep your sexual health going, one is squats. You're going to do them every day.
Right,
And
right.
number two is your Kegels. It's not for girls only.
That's right.
But this chair is amazing because if you guys don't know that you have, it's a P spot and it's so G spot for girls.
Yep.
And guys have an F spot, a P spot. So I love this chair because it's high FEM, high intensity frequency
Right.
magnetic field. And it actually stimulates the growth of the muscles and these nerve endings, which is amazing.
Right.
And also improves how your pelvic floor, so you're getting those Kegels. Like I think like 15,000 Kegels, like when you sit on that chair. It's
Yep.
kind of zappy. Some people felt like it's like electrifying, but it's amazing. Girls get orgasms on that chair.
I've
Yes,
noticed,
so
yeah.
we'll leave you privately for a moment. But these chairs are amazing. And we tell people, even if you do it once a week, it's great because
Right.
you're exercising your pelvic floor, which is so important because everybody should have fun in bed. And you know what? With age, we lose those muscles
Right.
and we need to keep them healthy.
Right.
So we say we train your core and we train your floor. So then you're whole and you're feeling good. So we're not missing something.
You heard it best. You really got to check out Dr. Iman Bar's clinic. It's a stem cell facility. It's a brain facility. It's a love facility. It's got it all. Please come on in. Give us a call. What's the best
Thank
website
you.
and email?
So it's DRBAR. So that's the old website. We still have that going. And I really appreciate it for taking the time and asking me these questions. It's amazing. I'm so excited. We're hoping to do a grand opening soon in December. We're just soft opening so far. And it was a pleasure to have you tour the facility and give me your opinion.
Well,
it's always great, Dr.
absolutely.
Fidalgo, to hear from you.
Okay, be well, be strong, and check out the next show. It's going to be fun, and I think you'll be really impressed what you're about to learn. Take care.
Thank you so much.